Okay, so I'm going to go through the muscles you need to know. Now, you will have in your modules a picture like this, and it will have the muscles you need to know. And you're going to have to not only be able to identify them, but also tell their movement. The best thing you can do is to make yourself a list of the muscles and then put down a real short movement of these muscles that make it easy for you to remember. So, just like there's a list of bones that you have, and you'll get a skeleton to label. Same thing you'll have for the muscles. And if you listen to the notes, then it will tell you about the movement, and I'm going to do the movement right now. So these are the muscles you have to know. There's a lot of muscles, but you only have to know these. So as far as the head muscles, you have to know the big muscle that goes along the side here. It goes up and down. I'm going to grab a head because it would show up a lot easier. Well, you can see it here. So this is your parotid salivary gland, and then there's a muscle right here going up and down. That's your masseter muscle. That's your big chewing muscle. You have two big circular muscles. You have the orbicularis oris here around your mouth that makes you pucker up, purse those lips. And you have a big circular one here called the orbicularis oculi that allows you to squint your eyes. And I'm going to add one called the zygomaticus. Well, actually, it's not on your list, so that's your smiling muscle. We won't worry about that. And we won't worry about frontalis. Okay, so that's it for the head. Most of you are familiar with the pectoralis major. If you write pecs on the test, I'll count it wrong. So you have to write pectoralis major. And the pectoralis major's main job is to pull your arms across your chest, which is actually arm adduction. We have big abdominal muscles here. Okay, if we're looking just here now, the muscle that goes along the side are your external obliques. Now, all your abdominal muscles compress the abdomen. They all have the same function or movement. But the external obliques are the outermost ones. And if we peel them off, then we can see your rectus abdominis underneath it. The rectus abdominis is in little sections that gives you much more control. If it was just one big muscle, it would, and you worked out all the time, it would pop out like your biceps when you flexed it. By having it in little compartments here, little sections, it gives you more precision control, and of course then they only bulge a little, which produces that nice looking six-pack. So you need to know your external obliques and your rectus abdominis. There are two others, but you won't have to know those. There's a muscle here along the side that's called the serratus anterior. This is how you punch people. If you throw a ball a lot, you're going to use this. It actually helps to move your scapula. It's called the abduction of your scapula, AB, abduction I always call it. But you can put punch, or you can put extend your arm. Well, I'd put punch. It's often called the boxer's muscle. Then, of course, most people are familiar with the biceps brachii here. The biceps brachii, of course, flexes the lower arm. You want to put flexes the lower arm because that's all it does. The antagonistic muscle, that you're going to have to know that word, is the triceps brachii along the back side here. It has three heads. You can see two of them pretty well here. And that extends the lower arm. You also have to know the around back, holding up your head, keeping your head erect, shrugging your shoulders is the trapezius. Works really hard. And then the big back muscle here is your latissimus dorsi. It is the antagonistic muscle of the pectoralis major, pulls your arms down and back. Of course, most people are familiar with the gluteus maximus. We really only use this if we're running or climbing stairs. But this extends your thigh and it laterally rotates your thigh. So if we throw our leg out to the side and come around, that's your gluteus maximus. Your minimus medius immediately move the thigh. You guys only have to know the 3 back muscles here. This is your hamstrings group. The primary muscle here is the biceps femoris. It flexes the lower leg. The antagonistic muscle of the 3 hamstrings, which were named that because they have really long tendons, and they used to hang meat to cure in the smokehouses. They would hang it from these long tendons of the hamstring muscles. In the front, you have the quadriceps muscles. There's 4 of them. The biggest one is the rectus femoris, and those 4 muscles extend the lower leg. You need 4 to extend the lower leg. You need 3 to bend it. Here you need more muscles because we're going against gravity to stand up. The longest muscle in the leg is the sartorius. It wraps all the way around here. Frogs have a big sartorius for hopping. We use this for sitting cross-legged or pulling your knee out to the side. They used to call this the tailor's muscles because tailors would sit cross-legged on the ground and for extended periods of time, so they had to use that sartorius muscle. You also have a series of adductor muscles, and those adductor muscles adduct the legs. They pull the legs together. The one that is most medial, most people, when they say, I pull my groin muscle, it's this one right here called the gracilis. The gracilis adducts the leg over here. This is one of your adductors. This is one of your adductors. One of the adductors you see around back too. But all of those is right in here. Adductors just do what they say they do. If you're on the adduction machine working out, you're adducting, you're pulling your thighs together. Down in the lower leg, on the front, we have a tibialis anterior muscle. The tibialis anterior muscle does what we call dorsiflexion of the foot. The heel goes down and the top of the foot comes up. The opposite movement, the antagonistic muscle, is your gastrocnemius, the big bulgy one back here that goes and inserts on the Achilles tendon or calcaneus tendon that runs down to the heel bone. When this muscle contracts, it does plantar flexion of the foot. The heel goes up, the foot goes down. You stand on your tippy toes. Ballerinas have to use that gastrocnemius a lot. Just want to make sure I got them all, and I do. So you'll have some muscle men to label. Again, if you want good practice, you can play an arcade game called Poke-A-Muscle. It'll help you to learn these muscles. But you will have muscle diagrams, or you'll have a little guy like this to label on the test. You not only have to name the muscle, you also have to tell its movement. And I forgot the deltoid muscle right here as I'm looking at it. That deltoid muscle, your shoulder pads, they abduct the arms. They pull the arms away from the midline of the body. Abduction is away, adduction is toward the body. So my pectoralis major and my latissimus dorsi are going to adduct the arms. Pectoralis major forward, latissimus dorsi backwards, but the deltoids abduct the arms. Make sure I didn't miss any others. That should be it for muscles.